treatment of venous disease and varicose vein disease has progressed over the last 15 years. With the old stripping procedure, as a patient of mine, you would come in, we would do the stripping procedure, you would come back and see me in my office one time, I'd make sure everything was okay, and that would be the last time I would see you until 2 years down the road when your varicose vein disease came back. Now we know we can't treat venous disease like that. We need to start at the source of the vein disease and progress outward if we're going to have a durable treatment. So typically, patients come in for an evaluation of the vein disease, which in our office takes upwards of an hour and a half to get the detail that we need to identify the source of the veins, to use the ultrasound to find those sources. Once the vein disease is identified and the source is identified, the treatments include both this endovenous laser ablation or endovenous radiofrequency ablation, which is melting of the main source vein. That is followed by a series of visits where we do ultrasound-guided sclerotherapy to the small branches that are left after we've treated the main. The reason that we bring you back and do the injections is that the small twisted veins cannot be entered with either the laser fiber or the radiofrequency fiber. And even though those segments will be smaller after treatment of the main source veins, they'll still be alive and will need to be treated in some way. We can either pull those veins out, a procedure called phlebectomy, or we can inject them with sclerosant, which is what we do here at the Southern Illinois Vein Center.